Below is a detailed comparison of pancreatitis and cirrhosis, exploring 15 important differences between the two conditions. 1. Definition. Pancreatitis. Pancreatitis refers to inflammation of the pancreas, an organ that plays a vital role in digestion and insulin production. The inflammation may be sudden and short-term, acute, or ongoing and persistent, chronic. Cirrhosis. Cirrhosis is a late stage of progressive liver damage characterized by fibrosis, scarring, and the formation of regenerative nodules. It represents irreversible liver injury from chronic liver diseases. Organ affected. Pancreatitis affects the pancreas, located behind the stomach. Cirrhosis affects the liver, the large organ located in the upper right abdomen. 3. Types. Pancreatitis. Acute pancreatitis, sudden onset, usually reversible. Chronic pancreatitis, long-term inflammation causing permanent damage. Cirrhosis, only one type, chronic and progressive. It is the final stage of chronic liver disease. 4 causes. Pancreatitis. Gallstones, chronic alcohol consumption, high triglyceride levels, trauma, infections, medications, e.g. corticosteroids, ERCP complications. Cirrhosis, chronic alcohol abuse, chronic viral hepatitis B and C, non-alcoholic fatty liver disease, NFLD, autoimmune hepatitis, Wilson's disease, primary biliary cholangitis. 5. Onset. Pancreatitis. Acute form begins suddenly. Chronic form develops gradually with repeated bouts. Cirrhosis. Gradual onset over months or years due to sustained liver damage. 6. Pathophysiology. Pancreatitis. Premature activation of pancreatic digestive enzymes leads to autodigestion of pancreatic tissue, causing inflammation, necrosis, and fibrosis. Cirrhosis. Continuous liver injury results in fibrosis and nodular regeneration, which distorts the normal liver architecture and impairs its function. 7. Common symptoms. Pancreatitis. Severe epigastric pain radiating to the back, nausea and vomiting, fever, acute, steatorrhea, fatty stools in chronic cases, weight loss, cirrhosis, fatigue, weakness, jaundice, yellowing of skin and eyes, abdominal swelling, ascites, easy bruising, itching, spider angiomas, gynecomastia. 8. Complications. Pancreatitis, pancreatic pseudocysts, pancreatic necrosis, diabetes mellitus due to loss of islet cells, malabsorption and weight loss, cirrhosis, portal hypertension, esophageal varices and bleeding, hepatic encephalopathy, confusion, coma, ascites and spontaneous bacterial peritonitis, liver cancer, hepatocellular carcinoma. 9. Laboratory findings. Pancreatitis, elevated amylase and lipase, elevated WBC count in acute cases, elevated liver enzymes if biliary obstruction is involved, cirrhosis, elevated liver enzymes AST, ALT in early stages, low albumin, elevated bilirubin, prolonged PT-INR, thrombocytopenia, low platelet count. Pancreatitis, CT scan may show pancreatic inflammation, fluid collections, or necrosis. Ultrasound can detect gallstones. Cirrhosis, ultrasound shows a shrunken nodular liver. Fibroscan, elastography, measures liver stiffness. CT-MRI may show signs of portal hypertension or liver tumors. 11. Treatment. Pancreatitis, hospitalization with IV fluids, pain relief, fasting to rest the pancreas. Treating underlying causes, e.g. gallstone removal, alcohol cessation, enzyme supplements, and dietary changes in chronic cases. Cirrhosis, managing the underlying cause, e.g. antivirals for hepatitis, alcohol cessation, controlling complications like ascites, bleeding, and encephalopathy, liver transplant in advanced cases. Chart 12. Reversibility. Pancreatitis. Acute pancreatitis is often reversible with treatment. Chronic pancreatitis may cause permanent damage but can be managed. Cirrhosis. It is generally irreversible, though early intervention may slow progression. 13. Risk of cancer. Pancreatitis. Chronic pancreatitis increases the risk of pancreatic cancer. Cirrhosis greatly increases the risk of hepatocellular carcinoma, liver cancer. 14. Surgical intervention. Pancreatitis. Surgery may be needed to remove gallstones or drain abscesses, pseudocysts. Chronic cases may require surgery to relieve duct obstructions. Cirrhosis. Liver transplantation is the only curative surgical option in end-stage disease. 15. Prognosis. Pancreatitis. Prognosis depends on severity and complications. Acute cases often resolve fully. Chronic cases require long-term management. Cirrhosis. Prognosis depends on the stage, compensated versus decompensated. Decompensated cirrhosis has a poor prognosis without liver transplant. Thank you. Have a nice day.